Hello, I'm sure you're familiar with the small bitter seed, popularly called bitter kola. This seed, also known as Garcinia kola, has been part of the African traditional medicine for centuries, meaning that we all know of its many benefits in Africa. Its popularity isn't just about tradition, even modern science is uncovering fascinating health benefits tied to this humble nut. Bitter kola offers several benefits, including aiding digestion. It is believed to support cardiovascular health and it possesses antimicrobial, anti-inflammatory, and antioxidant properties. Some individuals even think it might be helpful for diabetes due to its antioxidant effects. Additionally, it can improve respiratory health and is beneficial for conditions such as cough, catarrh, and cold. People often use bitter kola to create tinctures with honey for cough relief, and some claim it might assist in weight loss. Many individuals find it so beneficial that they incorporate it into their daily lifestyle. Some even take it with alcohol. However, here is a fact you might not know. Even though bitter kola has many benefits, it also has many negatives. It contains caffeine, that stimulant that affects the brain. That energy boosting jolt you feel after chewing it, that's caffeine kicking it. While this may improve your alertness and stamina, overconsumption of bitter kola may lead to restlessness, insomnia, or even elevate your blood pressure. And what about digestion? Bitter kola is known in traditional circles to ease indigestion and bloating. A small piece after your meal may be all you need for a more comfortable stomach. Some people may experience stomach upset and nausea and diarrhea after taking bitter kola. That means that bitter kola also has its own side effects. Now, bitter kola and arrhythmia, there's a correlation between taking bitter kola even when you have heart conditions. Now, bitter kola might affect your heart rhythm. It can lead to irregular heart rhythms. While often celebrated for its medicinal properties, bitter kola contains natural stimulants, including, like we said, caffeine and other compounds that influence the cardiovascular system. Now, although these stimulants may provide a temporal energy boost, they can actually affect how your heart beats. Now, for individuals prone to arrhythmias, which is irregular heartbeats, consuming bitter kola in large amount could be potentially dangerous and it could aggravate this condition. And why is that? First of all, the caffeine content. Bitter kola has a moderate level of caffeine, which can increase heart rate and potentially trigger palpitations or irregular heartbeat, especially with those with pre-existing heart conditions. For electrolyte balance, bitter kola's impact on body's metabolism might affect electrolyte balance, which is crucial for maintaining a steady heartbeat. Any disturbance in electrolytes like potassium, magnesium, or calcium can contribute to arrhythmias. Thirdly, overstimulation. The stimulant effect of bitter kola might overwork the heart, leading to episodes of tachycardia, which is a faster heart rate, or other irregular rhythms in sensitive individuals. So, should you avoid bitter kola if you have arrhythmia? Now, if you have a history of heart rhythm disorders, it is wise to approach bitter kola with caution. Small amounts, such as 1 nut a day, might not cause harm, but excessive consumption can alleviate your risk. When you take bitter kola with alcohol, it can increase your risk of dehydration due to its diuretic effect. Remember that alcohol has a diuretic effect, so bitter kola can exacerbate that. It can enhance stimulatory effects. It contains caffeine, like we said, and xanthine, which can interact with alcohol depressant effects, leading to increased stimulations and anxiety. It can also increase heart rate and blood pressure, and this possesses risk for people with cardiovascular issues. It can also enhance liver damage, so it should be taken with caution if you have issues with your liver. It can interfere with medications, particularly those used for blood sugar management and hypertension. It may increase the risk of bleeding when taken with blood thinners such as warfarin. It may lead to hypoglycemia, interact with your blood pressure medications, and lead to increased blood pressure. It can also increase the effect of amphetamine and may reduce the effectiveness of your antibiotics and antacids. It can also cause allergic reactions like itching, swelling of the face, your lip and throat, and difficulty in breathing, which can lead to anaphylaxis reaction. There is limited research on the safety on pregnancy, so it's best to avoid it if you're pregnant. Now, excessive consumption may also lead to toxicity. However, myths about bitter kola abound. Have you come across claims that it can cure infertility, diabetes, or even severe heart disease? These are mostly exaggerated. Bitter kola can complement health management strategies, but is not a all-cure medication. Now, in conclusion, the next time you see bitter kola, remember, it's not just a snack or a tradition. It has side effects and can interact with your medication, so you must take it with caution. If you must take it, start with small quantities like a nibble, and if you are not feeling fine, it's best you avoid it and consult your healthcare professional.